हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। विच ऑफ द फॉलोइंग इलेक्ट्रोलाइट एबनॉर्मलिटी इज सीन इन मिथेनॉल इंटॉक्सिकेशन? मेटाबॉलिक एल्कलोसिस विद हाई एनायन गैप, metabolic acidosis with high anion gap. This is the answer, because in the methanol intoxication what lead to the formation of metabolites including formic acid which causes the metabolic acidosis. The acidosis result from the accumulation of formic acid and its metabolite leading to increased anion gap. And what is the other causes? Ketoacidosis and uremia and lactic acidosis. Next question. A female patient present to the AIMS emergency department with severe fatigue. She is known case of chronic stable angina. And while collecting a blood sample, you notice the blood has a brownish hue. What is the underlying diagnosis? Carboxyhemoglobinuria, sideroblastic and methanoglobinuria is the answer, because the underlying diagnosis in this case of methemoglobinemia, because the methemoglobinemia is a condition which there is an increased level of the methoglobin and a form of hemoglobin that is unable to bind level of methemoglobin and then transport oxygen effectively. The blood sample has a characteristic brownish hue on examination. As the patient is known case of chronic stable angina, it is likely that she is on nitrates and methemoglobinuria is side effect of nitrates. Next question. A patient with peptic ulcer was treated with an H. pylori regimen. Which of the following is used to assess the success of treatment? Endoscopy, IgG antibody study, urea blood test and urea test of biopsy. Yeah, the correct answer is the urea blood test, because this is the preferred method to assess the success of H. pylori treatment. The urea blood test, the stool antigen test and biopsy based test and all be used to assess the success of the treatment. However, there are use less than 4 weeks after treatment may yield a false negative result. Next question. Hamman sign is seen in pneumoperitoneum, pneumopericardium, pneumomediastinum एंड हाइड्रोन्यूमोथोरैक्स. न्यूमोमीडियास्टिनम में पाया जाता है में सीन होता है हमान साइन, because the Haman sign is heard during auscultation of the chest and is associated with a specific condition called pneumomediastinum. It refers to the crunching or crackling sound synchronous with the heartbeat known as cryptus caused by air within the mediastinum. The sound is best heard along the left sternal border. Next question. A patient came to the hospital with complaint of lethargy, increased sleep and weight gain. Investigation revealed low plasma TSH concentration. However, on the administrations of TRH, the TSH level increase. Which of the condition is likely in this patient? Hyperthyroidism due to primary thyroid disease, hypothyroidism due to thyroid gland, hypothyroidism due to increase in the hypothalamus, hyperthyroidism due to decrease in the pituitary. Here the correct answer is the hypothyroidism due to decrease in the hypothalamus, because the scenario described in the questions is indicative of dysfunction at the level of the hypothalamus. When the hypothalamus sends low level of the thyroid hormone T3 and T4 in the bloodstream, it releases thyrotropin releasing hormone TRH. TRH stimulates the anterior pituitary gland to release TSH, which in turn stimulate the thyroid gland to produces and release T3 and T4. In this patient, the hypothalamus is not producing sufficient TRH, leading to decreased stimulation of the pituitary to produce TSH. Next question. An elderly woman is brought to the OPD with complaints of behavioral change, a history of multiple falls, urinary incontinence and dementia. What is your diagnosis? Normal pressure hydrocephalus, frontotemporal dementia, Parkinson disease, Creutzfeldt-Jakob disease. Here the question asks an elderly woman is brought to the OPD with complaints of behavioral change, history of multiple falls, urinary incontinence and dementia. What is your diagnosis? Normal pressure hydrocephalus is the best answer, because the NPH is characterized by classic trait of gait disturbance which can lead to fall, urinary incontinence and cognitive impairment. Dementia, behavioral change can also be a part of the cognitive impairment seen in NPH. This condition is caused by an accumulation of a cerebrospinal fluid CSF in the brain ventricles without a significant increase in intracranial pressure. And because the question says complaints of the history multiple false urinary incontinence and dementia, just catch up the main point and key point. Here the key point is a multiple false urinary incontinence and dementia. That's why the normal pressure of hydrocephalus. The answer. Thank you and keep revising.